This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
When you think of prostate cancer, you probably think it only affects older men.
Yeah, in fact, the American Cancer Society recommends that men who are not at high risk for the disease start talking with their doctor about blood screenings at age 50. Well, meet Trevor Story. He's only 9 years old and has been diagnosed with cancer in the prostate.
The diagnosis came just before Christmas when Trevor said his stomach was killing him and he couldn't use the bathroom. To make matters even worse, Trevor's health insurance will not cover all the treatments for the disease. His mother says that doesn't matter. They'll do whatever it takes to save their little boy.
Oh, whatever it takes. We'd sell everything to our name. I mean, what wouldn't you do for your kid? No?
Trevor's been through 2 surgeries already and faces 43 weeks of chemotherapy and radiation treatments. Well, chemotherapy has typically been the first line of treatment for cancer, but new technologies are making it easier to pinpoint certain characteristics of cancer that may allow the use of a customized treatment.
It's done by what's called biomarkers. And here to explain this breakthrough discovery is Dr. John Mansuetti, radiation oncologist at Peninsula Regional Medical Center. Thank you so much for joining us.
Thank you for having me. Thank you very much.
What are biomarkers?
So biomarkers are biologic characteristics of a tumor cell that we can actually measure in the lab. So we're able to take a tissue of the patient's cancer and send it to the lab and test for certain markers, these biomarkers. And these biomarkers give us 2 pieces of information. They give us both prognostic information and predictive information.
Okay.
And what I mean by that is prognostic information is sort of a measure of how aggressive the tumor is or how that tumor will respond to any sort of treatment. Predictive information that we get from biomarkers gives us more information on how that tumor will respond to a very specific drug, either a specific chemotherapy or a specific targeted therapy that we now see coming out more and more. In the cancer cell, there's a very complex and complicated information pathway within the tumor cell. And often the signals are mutated or abnormal, and sort of an on signal is turned on to grow. That's what cancer cells, they grow uncontrollably.
Yeah.
And so we have certain biomarkers that can actually detect this abnormal mutation that's turned this growth signal on. And so lung cancer is an excellent example. We have 2 biomarkers that we can test for, or that we often test for in advanced stage lung cancer. One's called ALK, the other one's called EGFR. And if a patient has this mutation that we can detect with a biomarker, we actually have a very targeted therapy that we can use. And in this case, in lung cancer, it's actually a pill that you can take every day rather than a cytotoxic chemotherapy that you would have to give by IV.
Now, when you say mutations, I think of the BRCA gene. Is that the same? Is that what we're talking about?
Exactly. That's an excellent example too. So in breast cancer, some patients have what's called the BRCA gene. There's 2, BRCA1 and BRCA2. And if you have this gene, you're at very high risk for breast cancer and other cancers actually as well too. And this is a genetic defect that actually can be passed down in generations. So if you had a daughter and you had BRCA positive tumor, you would certainly want your daughter tested too, because we certainly know there'd be a very high risk for breast cancer or other cancers in the future, and we could sort of prophylactically do something about it.
Okay, so you discover the biomarkers, then what?
So basically, once we discover a biomarker, and the biomarkers are very specific for specific cancers, and so I'll use lung cancer as an example again. We look for these very specific defects, the ALK and the EGFR, and it's just done in a lab test. Like I said, you send it to the pathologist, and once we find these, if they exist in this patient's tumor, we would initially probably start treatment with just one of these targeted therapies rather than doing more aggressive chemotherapy. So it's a very targeted therapy, and we can get very impressive results too.
And it allows you to target the treatment a little better?
Absolutely, and that's the great thing, is it tends to target the cancer itself while not doing much damage to the rest of the cells in the body. Chemotherapy is, in a lot of ways, is a poison that goes everywhere that can damage all the cells in your body. These targeted therapies are targeted right for the cancer itself.
And it puts off the chemotherapy, right?
Exactly. We can put off the chemotherapy, often in many cases, for many months, sometimes even years.
And what kind of tests for these?
Well, like I said, these biomarker tests, and it's very specific for each type of tumor. So another example would be melanoma. We would look for the BRAF mutation in melanoma, and if we discover that, we could use this medication that we have that would target this actual mutation, which is, you can get amazing response in that.
So how do you ascertain that? Is it a blood test? Is it a biopsy? Is it a...
It's typically you take the tissue from the tumor and literally send that to the lab, and
Okay.
a pathologist and a technician will test it to try to find these mutations in the actual tissue sample of the tumor itself. So oftentimes we have to go back and get more tissue on a patient's tumor so we can do these additional tests.
Should all cancer patients be tested for biomarkers?
So it really depends on what type of cancer you have, and so the biomarkers oftentimes are very specific to that cancer, but there is some crosstalk. Once again, I'll use lung cancer. The EGFR mutation, we also see that in pancreatic cancer, so oftentimes we would check for it in pancreatic cancer also, but you typically wouldn't check for, say, a EGFR mutation in breast cancer. But you would test for the HER2 mutation in breast cancer. So it's very specific to the type of tumor that you have.
So you've got a lot of success in specific cancers. How does it look down the road in the future? How does this look to you?
So I think this is the cutting edge of oncology in the future. We've sort of come up to a wall with both chemotherapy, surgery options, and radiation options. I think we sort of maxed that out or benefit from that. And so these targeted therapies are the wave of the future, and this is what's being worked on in the scientific community like crazy right now to try to discover new drugs that can very specifically target the tumor cell while sparing the rest of the cells in your body.
Which is pretty exciting.
Absolutely.
It is exciting.
Dr. Manswetti,
Thank you
Thank
so
you very much.
And of course, if you would like to learn more about biomarkers from Peninsula Regional Medical Center, log on to our website, delmarvalife.com, and click on the show tab. Now, while we're talking about your health, one way to avoid getting sick is to avoid coming in contact with germs. Up next, we'll learn some of the top germ collectors inside and outside your home. Some of them may surprise you.
Something else you may find in your home, mold, no matter how hard you clean. It could be in your bathroom or your kitchen. We're going to learn some simple steps that will stop mold from coming back on a regular basis. Plus the Chemical One cleaning agent that some say works well.
But first, we touched on biomarkers testing. Dr. Oz has more on how you can try to prevent lung cancer.
Hi, I'm Dr. Oz. Smoking is the leading cause of lung cancer. The effects of smoking are worse if you take vitamin A supplements at the same time. Studies show that low-tar nicotine cigarettes, well, they don't help much either. So quit smoking today, and your risk of lung cancer will be 30 to 50% lower in 10 years.